You are watching this video because your doctor has prescribed a soft diet for you to follow after your surgery. This diet is especially designed for you because it's soft in texture, low in fiber, and easier to digest. You should follow this diet for the next 4 to 6 weeks, or for as long as your doctor or dietitian tells you. If you still have problems eating once you get home from the hospital, call your doctor or dietitian. Here are the foods you should avoid for the next 4 to 6 weeks. Avoid tough, fibrous meats with gristle. Meat with casings such as hot dogs, sausage, and kielbasa. Lunch meats with whole spices or casings. Shellfish, chunky peanut butter, and nuts. Fresh fruit except bananas and avocado. Juices with pulp. Dried fruit such as raisins and prunes, canned fruit cocktail, canned pineapple, frozen or thawed berries, and coconut. Raw vegetables, cooked or raw corn and mushrooms, stewed tomatoes, popcorn, potato skins, stir-fry vegetables, sauerkraut, pickles and olives, and beans, all dried beans, legumes, and peas. Dairy products mixed with fresh fruit, berries, frozen or thawed, whole spices, nuts or seeds. Cereals with nuts, berries or dried fruits, whole grain cereals, bran cereals, granola, brown or wild rice, and whole grain pasta. Whole grain breads, breads and rolls with raisins, nuts, or seeds, and multigrain crackers. Any dessert that contains nuts, dried fruits, coconut, or fruits with seeds. Whole spices like peppercorns, anise seeds, celery seeds, rosemary, caraway seeds, whole cloves, and fresh herbs. Jams or jellies with seeds, popcorn, and carbonated beverages. After 4 to 6 weeks, you can start eating these foods again. Start slowly. Try a small portion of one of these foods each day. If it doesn't bother you over the next 24 hours, you can add it back to your diet. Keeping a food journal can help. Here is a list of foods you should be able to eat without any problems during the first 4 to 6 weeks after your surgery. Chicken, turkey, and fish, tender cuts of beef and pork, ground meats, eggs, creamy nut butters and tofu, skinless hot dogs, sausage patties without whole spices, bananas, avocado, canned peaches and pears, applesauce, cooked fruit without skins or seeds, nectars, and juices without pulp, well-cooked or canned vegetables, potatoes without the skins, tomato sauces, and vegetable juice, milk, cheese, yogurt, milkshakes, pudding, ice cream and sherbet, and cottage cheese. Low-fiber dry or cooked cereals with less than 2 grams of fiber per serving. White rice, pasta, macaroni, or noodles. White or refined breads and rolls, plain bagels, toast, and plain crackers and graham crackers. Plain cake, pudding, custard, ice cream and sherbet, gelatin, and fruit whips, all ground spices or herbs, salt and pepper, sugar, honey, jelly, mayonnaise, mustard and soy sauce, oil, butter, and margarine, candy and cookies without dried fruit or nuts, marshmallows, and snack chips and pretzels using refined flours. After bowel surgery, the amount of stool output often increases. Diarrhea is also common. If you have an ostomy, the output depends on several things: where the stoma is located in your bowel, your height and weight, and how much you eat and drink every day. The average ileostomy output is about a quart a day. The output should have the consistency of oatmeal or applesauce. It is normal to empty your ileostomy bag when it is between 1/3 and 1/2 full. You should measure and record your ostomy output for the first 2 weeks after you get home from the hospital. Jejunostomy output is much higher volume and more watery. Patients who have had a jejunostomy may need intravenous or IV nutrition. Colostomy output is much more like regular bowel movements, and the patient usually does not have to change the diet or fluids. There are special situations with all types of ostomies for which the patient will need to see a dietitian or a doctor. Chew foods until they have the consistency of mashed potatoes. Chewing is the first step in digestion. If it's done well, it can help improve absorption. You may also have fewer problems with blockage when the food is passing through your bowel. Eat 5 to 6 small meals per day and eat slowly. Small amounts of food may be better digested and absorbed than large meals. Separate beverages from meal times. Solid foods may not be absorbed as well if liquids are pushing them through the bowel. Sip liquids throughout the day. Drinking fluids quickly can worsen stool output. Simple carbohydrates like table sugar, corn syrup, honey, soda, and juice increase the amount of water in the bowel, which can cause a greater stool output. To avoid this, cut out high-sugar foods and fluids. Water is not always well absorbed and can increase your stool output. If this happens, you should drink an oral rehydration solution instead. Avoid sugar-free items that contain the sugar alcohols sorbitol, mannitol, or xylitol. These are often found in diet products, sugarless gum, and some medications. Sugar alcohols are not well absorbed and can make diarrhea worse. Limit or avoid alcohol and caffeine. Alcohol and caffeine are stimulants and may increase your stool output. Caffeine is also a diuretic that may increase fluid loss in your urine and stool. To decrease your stool output, replace simple sugars with complex carbohydrates such as pasta, grains, rice, potatoes, fruits, and vegetables. These foods add bulk to stool and slow the movement of stool through the intestine. If your stool output has increase the sodium in your diet. You lose sodium and other electrolytes in your stool. Eating salty meals and snacks and seasoning your foods with salt will replace some of the losses. Include a thickening food to each meal and snack to help thicken your stool output. Examples of thickening foods include bananas, tapioca, boiled white rice, baked potatoes without the skin, applesauce, smooth peanut butter, and oatmeal. If you're not absorbing food properly, you should avoid high sugar supplements. You will not absorb them well, and they may increase your output. Try low sugar supplements that have less than 10 grams of sugar per serving. These include a Glucerna shake, Ensure Active High Protein, Boost Glucose Control, and the no sugar added Carnation Breakfast Essentials. Protein powders such as Beneprotein can provide additional calories and protein. If you are having high stool output, you should avoid high sugar drinks, beverages that contain caffeine, and alcohol. Fluids called oral rehydration solutions are best absorbed because they have the same amount of sodium, potassium, and glucose as your blood. They help replace what is lost in the stool. Water is not absorbed as well as an oral rehydration solution and may increase your stool and ostomy output. You should limit the amount of water you drink and drink an oral rehydration solution instead. You can make an oral rehydration solution at home or buy a commercial oral rehydration solution, such as Pedialyte, Drip Drop Hydration, or Ceralite. To make your own oral rehydration solution, mix 4 cups of water, 2/3 of a teaspoon of table salt, 2 tablespoons of sugar, and sugar-free Kool-Aid or Crystal Light in a pitcher. Don't add ice or dilute the solution, as this could affect the absorption. You can sip this solution between meals. Gatorade G2 is a low-sugar beverage, but it needs additional salt for best absorption. You can add 1/8 teaspoon of salt per 8-ounce serving, or a half a teaspoon per 32-ounce serving. Your fluid needs depend on the type of ostomy you have. You must drink enough fluid to prevent dehydration. You should learn to recognize the signs and symptoms of dehydration. These include increased thirst or muscle cramps, weight loss of more than 2 pounds in 24 hours, dry mouth or cracked lips, an extremely low urine output or dark urine with a strong odor, low blood pressure, and dizziness or weakness. If you're having any of these symptoms, call your doctor's office during business hours or call the Cleveland Clinic Nurse on Call at 216-444-1234 after hours. Soluble fiber products such as Nutrisource Fiber, Benefiber, Metamucil Clear and Natural, FiberSure, or Citracell may help thicken your output and slow the passage of food from the stomach into your intestine. You should introduce fiber into your diet slowly. Start with 1 serving per day and gradually increase to 2 to 3 servings per day. Antidiarrheal medications, including Imodium and Lamodal, are effective in reducing ostomy output. You can buy Imodium over the counter, or your doctor can prescribe it. Lamodal is only available by prescription. A liquid form of Imodium and Lamodal is also available. Your doctor can prescribe other medications, such as codeine and opium of tincture, if your stool output is still high after starting Imodium and Lamodal. The usual dose of Imodium and Lamodal is 1 or 2 tablets 30 minutes before meals because they work by slowing the movement of food through your digestive system. They are not as effective when taken after meals. You can also take these medications before bedtime. You can take up to 8 tablets per day of each medication. If you have cramping, abdominal pain, nausea, vomiting, stop taking the medications and call your doctor. These symptoms may mean that you have an obstruction or ileus. If your problem occurs during business hours, Monday through Friday, 9 a.m. to 5 p.m., call your doctor's office. If the problem occurs on the weekend or after 5 p.m., call the Cleveland Clinic Nurse on Call at 216-444-1234. We hope this video has helped explain what to expect while you're on a GI soft diet. If you have any questions, please do not hesitate to contact your caregiver. Thank you for choosing Cleveland Clinic for your care.